Thank you for joining, everybody who've been able to make time today. Our restrictions uthi goise, so many folks are enjoying the beautiful weather outside, so cannot blame people. But again, from an ASCCA point of view, we wanted to really keep this momentum going, bring in more of the events that we've had in the past few months, virtual events. And today's is a very special event. So hopefully, everyone and their near and dear ones are keeping safe and healthy. So, the past year has been a challenging one, yet rewarding in many. Mute yourselves. I don't know who's the.
I think it's Pradipda and Dipaliati.
Olas to be mute kori parani tomorrow.
Yeah. So I mute all Korea rakhisilo, but just in case. Anyways, you know what? But yeah. So as I said, past year has been a challenging one, yet rewarding in many aspects. We've faced pandemic of this size, health sector challenges, to economic uncertainties, to home quarantine and confinement, to spending quality time with family, friends, over video chats, our family love gharar bonding, obviously, to the extremes of suffering from fear, loneliness, anxiety, managing emotions, well-being, and bonding that we see. So it's been an extreme of all sorts, right, that we've seen. And from seeing the entire, I would say, human civilization coming together, big words, but it is heavy, right? When you think about it, coming together to fight this dreaded pandemic, to losing many of our loved ones, many of our acquaintances. The past 15 months have been nothing short of a roller coaster ride, right? And as they say, these are unprecedented times, yet we see and hear stories of hope, of commitment, passion, resilience, and a very, very strong resolve to overcome this together. I think that's the beauty of this. Although there are the negatives, there are so many positives that have come out of the pandemic and our experiences. So to all the frontline folks who have worked and served tirelessly over the past, it's been 15 months now, and always, and beyond that as well, a huge thank you for everything that you're doing and everything that you do. We really depend on your strength and commitment. You are and you will always be our heroes. Let me cue off a short video that probably does justice to what the frontline heroes have been up to. So bear with me.
COVID-19 disconnected us from our lives. It separated us and forced us to focus on our basic needs we took for granted. Food, water, medical care, power, transportation, and public safety. In this moment, we thank all the unsung heroes who help us put food on the table, who keep clean water flowing, who keep the power on at home and where it's needed, who fight with the virus to save lives, who work silently to protect us, with determination, with courage, with compassion. These essential workers restore our connections to our families, our communities, and to our lives. to the essential workers who connect us to our lives. Thank you.
Perfect. So, as I said, I mean, it's a small tribute video, but it tells a very powerful story. Our discussion topic today, pandemic and beyond, embracing the new norm. It's really a humble attempt on ASCCA's part to bring together some of our community members, right, who are frontline heroes, frontline workers, and not all. There are many more. We've just got 5 of them here. To hear their stories, their viewpoints, their opinions of the pandemic in their line of profession and its impact in our lives. We've really got an inclusive and diverse panel today, as you can see, representing a cross-section of professions. And we have a couple of our next-gen community members too joining us. So that is really amazing. And before we begin, we must reiterate that each of our panelists here is in an individual capacity, and they're presenting their personal experiences and viewpoints. And this does not represent views from their employers or any organizations they may be affiliated with. So let me quickly introduce the panel and the moderator for today, and I'll hand it over to the moderator then. So we've got Dr. Manas Sharma. So folks, can you see my screen properly? All okay? You can, okay, great. Dr. Manas Sharma, who's a radiologist at London Health Sciences Center. Dr. Shohinee Sarma, Rikabuli Matobohote. So she's a clinical associate in endocrinology and internal medicine at University Health Network, UHN, and Mount Sinai Hospital, Toronto. We've got Shivani Patel, who we know is an amazing singer. And she's part of community living that provides support services to kids, youth, and adults who are differently abled. We've got Parvez Rahman, our ASCCA president. And he is from representing, well, not representing, but he's from the city of Hamilton and works in infectious disease program. And our panel moderator for today is Dr. Syeda Salim, Shahana, as we know, Department of Psychiatry at Oakville Trafalgar Memorial Hospital and Center for Mental Health and Addiction, CAMH. So without much ado, let me pass it on to Shahana or Dr. Syeda Salim.
Thank you, Palas, for that warm welcome. As we know, the little virus changed our lives. We are trying to relearn to live in a pandemic world. So it's my pleasure to be part of this discussion today with different other frontlines and people from our community. We are blessed that we are a little community, but we have so many frontline workers. Despite being a small community compared to many other communities from India. The aim of our discussion today is just to share our experiences, like Palas mentioned, our lived experiences, lessons learned as we embrace the pandemic. Okay, there might be technical challenges, but do bear with us and hope you enjoy the discussion. So let's begin our discussion. I want to begin by asking the panelists if they could provide us with a short introduction as to where they work, what they do, and how they were involved as a frontline worker in their respective jobs. Let's start with Dr. Manas Sharma. I'll be calling you by the first names. Manas, to me, thank you.
Okay, hello everyone. First of all, Palas, thank you. Dunia introduction, Lisa. Aru, Sahana, thanks. It's really been quite a year. Support karne, right? So more, my radiologist by background training. I work as a neuroradiologist at the London Health Sciences Center, like Palas said. There is two major hospitals in London Health Sciences Center. One is called the University Hospital, Namtue University Hospital, and the other is called Victoria. So I work at the university site, but cover the work for both hospitals. Plus, more pandemic related aorta aspect, which is I'm concerned with the management because I'm the site chief for radiology University Hospital. So and মানে হবলে সময় নাপালো আৰু হে যোৱা বছৰে হৈছো আৰু pandemicৰ মাজত. So there's some experiences related to that as well. So, here's more introduction.
Okay, let's move on to Shohinee. Tumi koba.
Sure, thank you. Thank you again to the organizers for putting this together. It's really appreciated. We all have worked hard, not just the healthcare workers, but all essential workers, and everyone in our society has come together during this time. So thank you again to the organizers. So yes, I'm going to be starting as a clinical associate staff at University Health Network and Mount Sinai Hospital in downtown Toronto in the area of endocrinology and metabolism, also covering some internal medicine, which is the overall specialty, and endocrinology is a subspecialty within internal medicine. But right now, I'm on vacation now, thankfully, but up until now, this month, I've been a resident in endocrinology, and I've also been the chief resident for the endocrine program, which means managing and covering all the issues and challenges that is faced by endocrine residents during the pandemic. So not the role I was hoping for in the middle of a pandemic, but that's what's happened. So that's where we are right now. And as residents, I'd like to bring the perspective of what it's been like during this pandemic and go from there. Thanks.
Thank you for joining us. Shivani, let's move on to you. And if you could introduce yourself and your interesting job that you do in the group homes.
Thank you so much for having me here. It's a pleasure. And this is really, really nice. Thank you so much to the organizers for this wonderful, wonderful online event. It's very much appreciated. So currently I am a child and youth care worker. That is the name of my profession. I just graduated for my bachelor's degree last year. And currently I work at a residential setting, providing support mostly to youth and adults with special needs, specifically with autism and other mental health concerns as well, and various behaviors. I worked in 2 different group homes since the pandemic, and I worked with youth and adults. And before the pandemic, we support workers, we used to take them out for physical activities, as well as other activities which involve community involvement, such as going on hikes, going to the walking track for health and wellness programs, going swimming, going to the library, and much more, and going to the aquarium, science museums, just to get them involved into the community. However, it has been difficult since the pandemic started because we are unable to do that now. And the thing about people with autism is they need to be kept busy. They need to be moving. So the thing is, if they don't move, then it kind of triggers their behaviors, and they get frustrated, and they wonder why they can't do anything. So it has been difficult keeping them home. We haven't been able to take them out anywhere for the past year and a half, almost a year and a half. But what we've been doing is the management has been taking care by making sure that we, the support workers, are supporting them at home by letting them go in the backyard, taking them on walks around the neighborhood maybe, and just doing some activities at home. It's not the same, but it's something. But my job as a child and youth care worker, as a support worker in a residential setting, is just to make sure that we support them and help them through their behaviors.
I'm sure it's such a difficult population to work with and lots of challenges. We'll talk about it further again. So our next panelist is Parvez Rahman, or my husband. If you could introduce yourself and what you've been dealing with in your role during this pandemic.
So I work for the city of Hamilton. Since the start of COVID, the whole organizational setup changed. A lot of people working from home. We had people in health protection. We had dental hygienists. So all those programs shut down. So all these people have been diverted to COVID response. So we have teams like case management. We have infection control team. We have a school team. We have an outbreak team. And we have outbreak supports and other admin staff. So they all have their specific roles. And I work for the outbreak team, and I manage outbreaks. So basically our objective is to do anything and everything to stop the spread and stop the pandemic.
Thank you.
That's what I do. We'll discuss about it later.
Mm-hmm. And a little bit about myself. I am a geriatric psychiatrist, so usually I see people over 65. Part of the pandemic, like Manas said, we all had like two roles. One is the clinical role, because I do some outreach. So I have been responsible for a group home in Toronto, part of CAMH, where we have around 200 clients, maybe around 75 of them have more persisting mental illness like schizophrenia, schizoaffective disorder. And the home had an outbreak during the pandemic, and to deal with their behaviors when they don't understand the pandemic, the cognitive part. Many of them are on injection, how to deliver the injection when you know they're COVID positive. How do we keep the staff safe and supported? That has been a big challenge. At Oakville, we were also involved in providing care to a retirement home. Suddenly, we were approached because their staff, 30 plus of them, were COVID positive, and similarly residents, they don't speak English, so that was another challenge. So all their staff were gone. We only had two staff. So a lot of team from our hospital, including infectious disease, allied staff, we had to take over that facility, provide them with assessments, care for almost like 2 months till their staff came back. So that was another very eye-opening experiences. I think the outpatient work was much easier, but the virtual care was fascinating and how we incorporated that. And part of my director role, we were also involved in a lot of resource planning. Some of our psychiatric nurses were moved from psychiatry to medicine and ICU. And who do we pull? You are given little notice to come up with a plan without, neglecting patients' care. The change in visitors policy and managing the anxiety of the visitor and the patients who were getting visitors and suddenly not allowed to come. So overnight, I think we had to deal with a lot of staff, but we did it. Yeah. Okay. So now going on to the next question. Again, we would like to know from each of you, now that we are, like Paula's mentioned, 15 months into the pandemic, if you think back how it was in March 2020 and now we are in June, mid-June, how have your journey been like? And maybe share one or two the difficulties, challenges with us and how you coped with it. Let's start with Shivani this time.
Thank you for the question. Well, when the pandemic started in March last year, firstly, masks were just introduced to us. But we had a shortage of masks and gloves at the time, which did make it quite difficult. But we had amazing people and other agencies who donated masks to our agency during the April and May of last year to really help us in the group homes. And we're really, really thankful. The individuals that I work with, they don't need to wear masks because it is their home firstly. And they don't seem to understand, a lot of them actually don't seem to understand the concept of even wearing a mask or even social distancing actually. So they don't understand what social distance is. They don't understand what's going on, to be very honest with you. And a lot of our individuals were living in confusion. We had schedules for them every day before, and they would be knowing that they're going to be going out, and they had a certain routine that they would have to follow. They knew that during a certain time of the day, they are supposed to be going out. However, since the lockdown started, their routines changed. Now, people with autism often need to have routine in their lives, and they stick to that specific routine. If you want to change their routine, you need to be very cautious, because even a simple change can trigger them and it can trigger their behaviors. But this was not a simple change. This was a huge change. We had to unfortunately take away their daily outing, which is a big change, and that did cause aggressive behaviors for a certain amount of time, quite a few months actually. And a lot of the individuals that I work with are nonverbal and they have aggressive behaviors. They're unable to express how they feel, and that may result in physical aggression. So initially this was quite difficult. But however, as time passed, it started to get better, and they started to become less agitated about not being able to go out. And at the moment, most of the individuals seem to be fine with what is currently happening, because they have a certain routine now that they just got used to. So things are fine at the moment with them. But when it comes to staff, now along with masks, we are required to wear either goggles or face shields as well. And of course, we don't have a shortage of masks anymore, because this has become a norm for us. We have masks now, we have everything. So we're fine now. But yes, it was difficult during the beginning of the pandemic.
So let's go to Shohinee. Shohinee, if you could share your journey.
Sure. Thank you. So I want to take a step back before I share my journey to provide a glimpse and going down memory line as to what the world faced at that time and what the world's journey was. So we had, I think it was March 6th, all of a sudden we heard news that the virus was really here and we were going into lockdown, and the panic that it created. But several months prior to that, most people in the healthcare field already knew of the virus. Thankfully, we knew of the virus because there was one healthcare worker in Wuhan who decided to speak up despite the repercussions from his government, decided to speak up and told us the whole world about what was happening in Wuhan. So we knew about the virus even prior to that. My background is in public health and epidemiology even prior to medical school, and I'm now continuing with that with a PhD, so that's something I feel very passionate about. But one part of epidemiology and public health is to understand how we can trace whether it's non-infectious disease, but also infectious disease. And so it just so happens that we live in a city that is one of the world's #1 hotspots for any infection. So it seems to be surprising because it's Canada, we're in the middle of snow and ice for most of the year, but we're a direct route from most provinces in China. And so whether it's SARS, whether it's H1N1, whether it's avian flu, or whether it's COVID-19, the spread is always very similar. So you have, Wuhan or Guangdong province, China, or one city in China, and then the next place for the virus to appear is usually Toronto. So that part is quite fascinating. So we in the healthcare field, especially in downtown Toronto, we knew about this virus. We knew it was coming. And we had 6 cases in Sunnybrook Hospital where I did a lot of my endocrinology clinics, even in January. But at that time, we weren't afraid yet, I think. So it took us until March for all of us to take notice and start to develop the fear, and then the rest is history. But in the initial stages of March, my role as a resident was, at that time I was rotating through St. Michael's Hospital where my father also works. And I was in clinic and consult service at that time, meaning that half of the day I see patients in clinic, then I go into the hospital wards, and then I start seeing patients on the hospital wards. And I'm sure Shohinee knows this very well, but when you're on the consult service, you're seeing patients all over the hospital in every possible ward. And so these are not just potential COVID exposures, but these are all also patients that may have other infectious diseases. So I see patients with tuberculosis, I see patients with MRSA infections. So you're completely exposed, not just to COVID, but to all other infections in the hospital if you don't have PPE. And at that time, just like Shivani said, suddenly we no longer had access to the one little thing that shielded us from the infection that was suddenly no longer there. And yet your role as a physician is still there, and you still have that duty, and you're still bound with that responsibility to provide care. So then you're going into wards, you're going into rooms, there are no gloves, there are no masks, there are no gowns, you're completely exposed. And I think that level of fear, I don't think they faced during SARS. I don't think they faced that at any other time. Perhaps back in the 1800s, they may have faced that, but since then we had PPE. So that was, I think, an incredible new thing to have faced during this time. And of course, people did step up. Seamstresses started making masks. Construction companies donated PPE. So thankful to all of society for stepping up. But that was quite the challenge. And then on a similar front, at home, we have 2 physicians who are completely exposed at the workplace, who then come back home. And of course, we're not vaccinated yet because the vaccines are still in development. So my father would do all these interventional procedures in a close environment where you don't know if the patient coming in acutely has COVID. And for him, it's even more scary. Because, well, to me, it's scary that he's been placed in this position, but it is scary because he's doing acute stroke care. And so there's no time to get a COVID test. You don't have the privilege of waiting to see if it's negative before you go into the room. So that part was scary. At least for me, I can wait to see if the patient is negative or positive before walking into the room. So that part was scary. And then at home, of course, we are all separated into different rooms, trying our best to keep as apart as possible, and quarantining in our own individual little rooms. Mom is in one room, dad is in one room, I'm in one room, because that was the time that's been our entire year at home. So until we were vaccinated. So I think that's been the biggest challenge, both from a personal and from a professional perspective. But again, people have really stepped up. We've had so many colleagues stepped up to help each other out. One example that my dad told me that stood with me was that his anesthesia colleagues really took the front of the burden by always walking into the room first, intubating the patient with aerosolizing exposure, and then taking the wealth of that exposure on themselves, and then waiting for 15 minutes until it all cleared, and then allowing people like my dad, who are the proceduralists, to then go in. So I think that really stood with me. Similarly, on my end of things, I've had so many examples of older physicians, who are over the age of even 65 or 70, and who are at increased risk, because we know age was an increased risk, at least for the first variants. And knowing that residents who are younger, who offer to do their clinic on their behalf, or offer to go to the ward on their behalf so that they would not need to, we've seen plenty of examples of positive behavior that way.
Yeah, I agree with you, Rika. There have been so many heroes within the hospital and outside, right? Stepping up despite the fear, taking each other's role, prioritizing who would be more at risk, keep them away, trying to save their resources. I agree, a different field. So maybe let's move on to Manas, and if you could share your journey last year compared to today.
Yeah, thank you, Sana. Thank you, Rika. Yes, all of more internet connection to unstable. By chance, just text me somebody. So it has been an interesting year. MBBS we had a book, Microbiology, that the 4th chapter I still remember was about coronaviruses, virus section. And that's all I knew about the coronavirus. That episode after MBBS came out to radiology, nothing to do with viruses. And the next thing I hear is like, boom, there's this coronavirus coming out of China. We were not afraid it was a distant thing. Rikhai jibur procedure kotha koise he tenuka dhৰণৰ procedure bur ami kori thaku patient face koru ba ekor nezanu ki hoy, we don't know what's going on with the patient, but prothomate iman afraid nasilu. Then suddenly, as news trickled through, right, we all learned about the virus, we all learned about the transmission, and then we started worrying about it. And it became pretty, it was a crescendo, right? We started worrying so much that we were fearful to even go near the patient. And then we had to evolve protocols. Like Rikhai rightly mentioned, Kuri says, the anesthesia started taking over the patients. They would deal with it so that they don't expose anybody. All these things came out. So a kind of thing that stands out here is that it's not about just the technicality. It's also about the human side of it. Like it's supposed to be my patient when I'm doing a procedure on the patient, but anesthesia steps up because they have to do it anyways. So they will use the necessary protection and then they will say, hey guys, don't come in here. Let us set this up. They will take that 15 minutes, which is huge, right? And then we could see all of that. And tomorrow at a flaw kisuman expose holes, and we don't have the mechanics in place for dealing with this kind of situations. Suddenly, we were worried. We here in London, we are running a stroke service that is for hyperacute stroke, which covers entire Southwest Ontario. So if 4 of us get sick, then there'll be no one to take care of any of the stroke patients in Southwest Ontario. So things like that. When a patient transfer korbo lagbo, obviously, ami endpoint nohoy, kintu That's a huge deal. So those kind of things, we had to start cohorting people last year. We kept 2 weeks away a team, a half team the run koribo laga hoise. So those kind of things evolved as things developed in March and April, which was big. PPE shortage, Shivani mentioned PPE shortage was so huge, we were asked to keep our N95s and use them multiple times. Right? These are things that are, India kam korisu agote, so I know that some things we do there. We are much more better geared there to tackle with more infectious conditions. Yet, I mean, we take things for granted, right? We realize that these things are precious. Our tapisot hekarne, hey, learnings were on the way ahile. And what has happened now is when the second wave came on, we were much better prepared, not just in terms of infrastructure, PPE supply, abundance. We already had the workflows established. So then we kicked in. Whenever we had to cohort, we started cohorting. Okay, we know how to cohort now, right? So hey, kothabur bahut bhal hol. And this is what the pandemic has taught us. In terms of going into the future, I hope we never let our guards down and these things remain in place, right? So that has been more or less the summation of the learning process that we have been through. Hospital.
Thank you, Manas. Next, maybe Parvez, to me, Tumar Pinopra. How have things changed compared to last year? Maybe apart from the things that have already been discussed, is there any, from public health angle, any new things you want to share?
Yeah, so thank you, Manas Sharma. It's a good hospital perspective, but I will take you on a slightly different tangent where most of our community people haven't been there because we don't fit into that profile, or we don't have people in that age group who are actually vulnerable populations. So I would go directly to where the pandemic was badly hit is retirement homes and long-term cares. That's where this whole thing started. And right from the beginning, it was, first of all, and then again, why an outbreak is declared in these areas so that we can put in enhanced practices and put all controls so that, the pandemic, the outbreak or the number of cases in these places do not climb and people don't have to rush to the hospital or, the outbreak is contained. So I'll just give you a few examples of the challenges that we faced. Is retirement homes, when it first started, staff stopped coming. So when an outbreak is declared, we get into a meeting every day, like public health, then the director of that retirement home or long-term care, then you have the hospital staff, the hospital long-term cares, sometimes the hospital staff take over the outbreaks. Then we have representatives from Ministry of Health and Long-Term Care who runs these long-term cares. We have retirement home regulatory authority who looks after retirement homes. So all these agencies come together and we chalk out a plan how to best manage the outbreak. At one point of time, there were no dietary staff to feed the old people. They all went home. They all fled. They're all scared. What do you do? Lynn, who they reached out from Niagara to Toronto, all the colleges and students, where they could hire people and staff to support these long-term cares and retirement homes. That is one part. PPE. So I'm just throwing these, these organizations up there because these are big organizations. Our kids should know what they do. Like something like Public Health Ontario, they provide the scientific evidence. They give us all the technical knowledge. They provide the technical knowledge to Ministry of Health and Long-Term Care, who frames the rules and take it to legislature. And these are rules. Okay, this is how you're going to manage a long-term care. This is how you're going to manage a retirement home. Then you have what else? Emergency services. So Shohinee would know. What do you do when there's an outbreak in a prison? What do you do when there's an outbreak in what do you call it, in a hangar where aircrafts are maintained. 500 people working there. What, you have 2 cases, what do you do? Do you send everyone home? Or do you say, okay, just you guys stay home, others can work? 2 days later, you find there are 30 more cases. What do you do? The guidance documents, which are provided by the Ministry of Health and Long-Term Care and Public Health Ontario, is just like a needle in a haystack that, okay, 1 case, you declare an outbreak. But what do you, these operations cannot stop. They have to go on. Shohinee, you work in, where people deal with mentally disabled or challenged people. Say in a prison, there's an outbreak, what do? These people, you can't tell, okay, all of you go for testing. They can't go for testing. You have to dispatch EMS. EMS, we are so thankful for EMS. They have tested in hundreds and thousands of people. They go and test all these people in there where they need to go. And yeah, it has been it's been long, it's been tiring, but so moving on from retirement homes, then it went into the community. So there's a totally different shift. What we see is, the color codes and all that is something the federal does. We are not. We are just involved with how to manage the vulnerable populations and group homes. There are so many group homes that our community probably don't even know that exist. So yeah, it's been long. It's been testing. We've come a long way. There's been so much of learning, and hats off to the government. You don't see what's going on in the background. How to handle, how do you handle this? The Ministry of Health and Long-Term Care, the Ministry of Labor, the Public Ontario, they have been working day and night, changing guidance documents, changing protocols, what to do next, So yeah, it's been a long time.
I agree. I think only other thing I would add is the virtual care, right? Like, I know, especially in psychiatry, they've been trying for 10 years to provide virtual care guidelines. But once the COVID happened, I think within few weeks, we are running so many clinics on virtual care. It's not the same as seeing persons face to face, but at least we are able to provide something. It has its own challenges. I think we've come a long way. The other thing which I find compared to last year, I find I'm seeing much more sicker people, because as I deal with mental health, many of the clients were so anxious, they delayed coming to the hospital. Now they're much more acute. We are needing much more in terms of treatment, planning, discharges, etc., to keep them well. And I'm seeing a lot of staff with lots of, stress and burden and burnout. So nurses are a strong part of our team. And when the nurses are absent, then doctors have to take on more roles. I think it adds. There is a whole system. Usually we are used to it. So overnight, doing so many things, we are much more prepared, I think, compared to last year. But I'm sure there are more lessons to learn. I think going back to the next question would be, what are some, every cloud has a silver lining, right? There are always lessons we learn from COVID. Maybe each panelist can share with us 1 or 2 lessons that they would like to continue forward and what they have learned from this pandemic. Let's start with Manas. He's busy with his phone, I think.
It's about the London incident. Okay, anyways, yeah, learnings, obviously, it's been such a huge experience, like all of us outlined, right, in different spheres. A lot of things to learn. Any overall take to Bhabute? I think it's the necessity to be prepared, right? You have to be prepared for all these unforeseen circumstances. It's nice to do exercises and say fire planning and kiba exercise. You need to think out of the box. And, the world is a small place. Something that happens in China can happen here right away. like Shohinee outlined, right? So you have to be prepared for all these kind of things. And what I've discovered, again, from a management angle, is that, many times we're so entangled in the process of things. But my clinical side that stands out a lot to me. It's not always about, putting a dot in every I and cutting every T about the process. It's also about making things actually work, thinking out of the box and delivering the deliverables, right? So, hey, that has been a big learning experience for all of us as a team. Sometimes you have to think on the fly, and sometimes it is okay in the larger interest to not exactly follow the defined process, because the process was not thought about these kind of unusual circumstances in the first place. So he too hoise at a downward learning point. At the same time, the positive side that came out of this is, again, like I mentioned earlier a little bit too, it's the human side of people. Healthcare workers, agically everything healthcare has been so subspecialized that people work in their own corners, and they're only concerned with their own little thing, right? Whatever procedure korisu, I'm doing that procedure. Reporting korisu, report korisu. Everything is connected. You have to stand up for each other. You have to cover each other's backs. So we have seen technologist staff, everybody rise up to the occasion. There was a time London specific vaccines were in shortage everywhere, obviously, Canada, right? So Toronto been prioritized, so all our vaccines were taken away. So, and then, it's a little bit technical, basic technical, let me just mention, radiology is taken to be like, people think of radiology as like people who sit in dark corners and report on scans, right? And there's a lot of procedures being done, and which means there's a lot of supporting staff like it. So technologists, nurses, radiographers, they have to go. Our COVID patients are chest X-ray like every day. So one radiographer has to go do that X-ray, right? They count the nurses, they count the people who are right in the front lines, and they don't count that other person as the frontline worker. So able management of flawed ekagol. So then we had to rise up to fix that occasion and kind of, push for these guys. So at a homo vaccines were short, people were frustrated that they did not get vaccines. Their colleagues in Toronto had gotten vaccines. We did not have vaccines. So we had to really motivate people, push them. But again, it just brought out the human side of people, how people, stand up to things in the face of adversities, and that human side is what actually keeps us going. So yeah, that has been another aspect that I silently observe and think, which is great. I mean, times are stressful, obviously. Who wants to have this? This is not a choice. But then you look at the good side of it, and there are many.
Yeah, that's wonderfully said. What about Shohinee?
Sure. I think one of the main things I have taken out of this past 15 months and what I've observed is the ability of the world to come together. So really, I think a pandemic is one of the best examples of global collaboration. And even despite that, we see vaccine inequity, countries like Canada getting so much more now at this point in time, share of the world's vaccines, whereas countries in maybe Sub-Saharan Africa, by South America, by South Asia, they don't have that level of vaccine equity yet. But the ability of the world has come together, that we are listening to each other, that I have never seen at this level before. And especially in the area of scientific research, I have never seen this before. I think this has really, really showcased how we can learn from what is happening in other places. So Agote, I think there's a little bit of, I would say, pride in, how North America or Europe or the Western world conducts research. And oftentimes stories or research coming out of other countries may not be as deeply regarded. But now that I think has shifted a bit. So we have examples, for example, with the Serum Institute of India, Adar Poonawala's institute, making the most number of vaccines for the world. So there's a little bit more of that global shifting where the power that was previously in place is now a little bit more distributed, it seems like. So that has been something that I take as a big positive. My grandfather, actually my mother's father, he was a civil surgeon of Assam back a long time ago. I've never actually met him, but I've always heard the stories. He was part of the smallpox campaign during that time and played a huge role in going door to door across all of Assam to vaccinate people. So I take a lot of I love the history of medicine. I take a lot of those stories to heart, because to be able to overcome a public health pandemic requires that level of collaboration and that level of dedication. And in his time, they didn't have social media. They didn't have the way the world collaborates now. They didn't have those back then, and yet they still eradicated the smallpox virus. So I think there's a lot to be taken from the history of medicine, but also now we have all of these new things with social media, with the world being able to be a bit more closely knit. So I think there's a lot of hope that hopefully the next pandemic, because there will be more for sure, hopefully with the next pandemic we will be a bit more prepared, and hopefully we will be a bit closer knit even for the next time. So that's something I take a lot of, I feel a lot of hope for.
Yeah, thank you, Shohinee. Shivani, well, what would you take the message?
So for me, it's actually one learning that I've actually taken during this pandemic is do not take things for granted. Food, water, your family, your friends, anyone around you, anything that you have, don't take it for granted. Be happy and proud of what you have, and also try to do something that you've never done before. Actually, I know a lot of people have been posting on social media, whether it's Instagram or Facebook or something that they've done with the time that they've been at home, and when you're not working, try something that you've never done. Like for me, it was learning to cook a new dish. So something else, you know. Another learning for me that I've taken during this pandemic is being positive. I constantly hear a lot of people say a lot of negative things, which I don't blame them for. I understand that there's a lot of negativity in their mind right now, and it's understandable because it is frustrating. But also let's try to be a little more positive about what's going on. So being negative won't really solve anything, and as cliche as it sounds, you might as well fool your heart sometimes and think a little positive to get, you know, through a day with a smile. So yes, appreciating what I have and not taking things for granted and just being positive are some of my biggest learnings.
What about Parvez? What did you learn from the pandemic?
Yeah, it's been long, so we've just, you know, perseverance, and you keep the hard work, keep going and going and going. It has to end. So there is light at the end of the tunnel. But apart from all that, I think there's a huge revamp coming related to retirement homes, long-term cares, to all congregate living settings. Homes. There's going to be a sea change in this area, and I think the Ministry of Health and Long-Term Care has already started. The government has already started the process. It was a neglected sector, and this will change. And they have started changing this, so that we don't have so much this vulnerable population suffer if something of this sort happens. So,
Thank you. So this is to the last question of this discussion. So Shohinee, if you have to describe in 3 words the pandemic, what would those 3 words be?
Personally, it's mostly negative words in my mind, but I'm trying to shift that perception a bit because you see, I didn't really talk about it before. I'll mention this briefly, but for residents, probably across the country, but for residents at the University of Toronto, this past year has been all of us trying to hold on and completing our specialties, so more specialty endocrine, while at the same time we being redeployed to go cover COVID wards. So hey, duita try kore asami kore bole kuno mate tar opor mane coursework sob thake. So bahut COVID shifts korilo, unfortunately bahut sadness dekhilo COVID that's been it has to stick in my mind. I cannot put a positive spin to that, and that's the reality. Kintu, I think 3 other words I think would be hope, I think of collaboration, and I think would be I think some, as Parvez Mama said, preparedness. I think those are the 3 things I would think.
Manas, to make it in the word koba. to describe the
Okay,
pandemic.
muk pasta word diba.
Okay.
ঠিক আছে মই পাঁচটা word কলে কি কম জানা limiting and frustrating but eye opening and enlightening মানে ভাল কথা হোৱা নাই definitely কিন্তু sometimes you need certain things যিবিলাকে তোমাক forces you to look inwards and think about yourself, think about how we are structured, think about how we do things. So I think in that sense I find it of course limiting and frustrating as everybody else, but also eye opening. আৰু তিনটা word যদি তথাপিও লাগে
Can hear you.
That's why
Manas.
Manas is on mute.
Oh, মই মিউটত আছো নেকি মানে
No, এতিয়া কোৱা মই খালি তিনটা word to শুনা নাই বাকিখিনি শুনিলো
তিনটা word মই লিখি দিছো বুলি ক'লো আচ্ছা মই কিবা এটা চুলো তাৰমানে ন এইটো লিখিব গৈ পেলাই তিনটা word ক'ব লাগে বাকিখিনি ক'লো ন এই তিনটা word ক'ব লাগিলে মই কম yet we thrive মই লিখি দিছো এটাতে
Good. Parvez, 3 words to describe the pandemic.
Okay, দুটা বেয়া এটা ভাল ঠিক আছে It has been very long and it has tried, but this will end.
Yeah.
Well, even if it doesn't, but you know, we'll be able free, we'll be able to enjoy again.
Okay. Shivani, your 3 words, please.
So my 3 words are surreal, being patient, and another word I want to add is self-care. Actually, it's very important for people in our field who are essential workers like all of you, actually, who are doctors, nurses, people who have been working during the pandemic. Our job is already very tough, so we don't need time when we're home. So when we get home, we should do something that helps us, feel positive and makes us happy. So for me, it's practicing music, it's singing songs, listening to music. Someone else, it could be working out, it could be dancing, it could be reading a book, catching up on your Netflix show, listening to a podcast, anything. So self-care is very, very important because it helps us balance our emotions. It helps us, being positive, and it helps us getting rid of that burnout feeling, so these are my 3 words.
Yeah, and I think maybe my 3 words will be adaptability, resilience, and technology. So on that note, thank you so much. We've come to the end of this discussion. It's been really interesting and eye-opening to look at frontline and how you faced challenges and moved on. Palas, do you want to share the screen? I want to end with a reflection. Something we use a lot is, we all know, I don't know who said this, difficult road often lead to beautiful destinations. And maybe as we recover from this pandemic, we will have different curves, different graphs, depending on our loss and what we've gained. But let's hope we all continue to climb this mountain and come up stronger. On that note, I hand it over to Palas. Remember, there is a kids section, so don't leave. There's a beautiful program the kids have collected. Thank you. Okay.
Well, thank you, Shahana. Obviously, there is a kids section, so I'll reserve my thank yous and closing notes to a bit later, and let's go on to something that the kids have put together here. You know what, this was again Shahana's brainchild, I must say, and she has worked tirelessly and to put this all together. But it was really pleasing to see some of our kids, next generations, come together to put this together, to put this video together, as an expression of gratitude and what gratitude means to them, right? Their thankfulness. So let me just let me just share my screen and start off that video. So everybody else, if you can just mute your lines, just in case there are any echoes and stuff, okay? So hold on for a second and we will just get started.
The pandemic hit us all as much, if not more. Our world changed. Many of us lost contact with our friends. We miss playing in the park, visiting friends and family, having get-togethers. This little virus changed our lives forever. Let's hear from Rihanna what she has to say about it.
Hi, Hi, my name is Rihanna, and today I'm going to be reading a poem I wrote about COVID and my experiences with it. Before that, I just wanted to say thank you to all frontline workers and their help with the pandemic. Okay, I'm going to start reading. Outside, the world was crazy. It was taken by a virus. For me, it was real lazy, but some other were lifeless. First, there was a break, but then the world shut down, wondering how many lives it'd take, but with nobody around. The news said not to panic, but everybody did, and everyone was frantic. What would happen to the kids? Days went by unused, our eyes glued to a screen. But what else could we possibly do but load up on caffeine? The news spoke to us daily, but nothing was clear. It was only maybe. People dropping dead like dominoes, but some will never ever know. Case numbers rose every day, but will it ever even go away? A cough, a fever, a short of breath may untimely lead into your death. Our summers flew by fast, but not a toe out to the world. No one knew how long it'd last, so I tried to be a good girl. Our lives had changed overnight. We learned all the new rules. We stayed together trying not to fight, but trying to focus at school. Our computers were our friends, of whom we never parted. We'd stay with them till day's end, and our family disregarded. Our masks became the norm, like a second body part, and we'd always perform, but of course 6 feet apart. We tried to stay upbeat, or at least we did pretend, taking up a hobby with all the time to spend. This year had been really hard to comprehend. All of us are just waiting till it ends. It's easy to focus on the bad, wondering all that we could have had, but look closer and you will see something that can make you happy. This chapter isn't over, but we still live with that virus, but it's not too late to find things that inspire us. Thank you.
Gratitude can help us all cope with the stressful times like the pandemic. Did you know people who practice gratitude have better immune system and better physical and mental health? Let's ask our 3 new grads what gratitude means to them.
Hi, I'm Gargi, and what practicing gratitude means to me is to take a moment to step back and appreciate all the little things that pass us by in our normal day-to-day. So some things that I'm grateful for, in addition to my wonderful friends and family, the roof above my head, and the food I get to eat, are really small moments, like getting to see sunrises and sunsets, or watching fireworks with my family on Victoria Day long weekend, or even coming in after shoveling the driveway during the winter to curl up with a nice mug of hot chocolate. Just small moments, but ones that bring immense tranquility and a quiet sort of happiness that ultimately make life worth living.
Namaskar, my name is Loya Buyan and I'm from Burlington, Ontario. Gratefulness to me is taking a moment in your life and appreciating the things that I've taken for granted. I am grateful for planet Earth, the oxygen that we breathe, the water that we drink. I am also grateful for my friends, family, and dog, and I am most grateful for my phone, as to which I would have never recorded this video. Have a great day.
Gratitude for me is simply just showing appreciation, especially for the little things in life. And I know that during COVID especially, we've all had a lot of time to reflect and just appreciate the little everyday pleasures that we may have taken for granted in the past. And I'm grateful for a lot of things, but I'd have to say the main things that I'm grateful for include my family, my friends, my health, and of course this amazing planet that we live on.
Let us listen to what some of the elementary kids are thankful for. Hi, my name is Cookie and I'm thankful for my brother Yuvi. I am thankful for my brother Yuvi because ever since the pandemic started, I had no friends to play with and I wasn't able to go out. So playing with my brother Yuvi was what entertained me. Bye! I'm thankful for my parents and my brother and my sister. I'm thankful for everything that they do to me. I'm thankful for my teacher that teaches me. I'm thankful for my dad works for money, and let's hear from a psychologist what she has to say.
Hello everyone, today we are talking about gratitude or gratefulness. We have often heard about the expressions attitude with gratitude or Gratitude means that we are being thankful or appreciative of things that we have, be it tangible or intangible. People who practices gratitude in their daily life seems to be more at peace, and they seems to have more of a positive attitude towards life, and that which makes them more happier as an individual, and they don't tend to be bothered about small things or small day-to-day activities, and they seems to be grateful of what they have. Instead of focusing on the negatives, they tend to focus on the positivities, and that is why they are at content or peace at their life, and they are people who have low stress, or the rates of depression seems to be lower in those individuals. Also, as everything in gratitude is also very infectious. People who are grateful or gratitude or have a positive attitude towards life seems to affect people around them very positively. Thank you and have a good day.
And finally, from our little kitty, a thought. Well, not so little anymore. And remember to practice gratitude every day in your life and be happy.
I say thank you.
Why do you say thank you to people?
It's because if anybody shares with you or maybe plays with you, you have to say thank you and bye-bye.
Are you happy when you say thank you?
Yeah.
Do you say thank you to the baby?
Yeah.
And whom do you want to say thank you?
To everybody.
To whom?
To everybody.
You want to say thank you to everybody?
Yeah.
Hello everyone, my name is Anula.
And my name is Avni.
We just wanted to say from our hearts, thank you to the healthcare workers and the frontline workers.
They have been working really hard since the start of the pandemic until now.
From endless hours
to coming home late at night.
We couldn't thank them enough.
We thank all the frontline workers and all the healthcare workers who have helped us make our lives easier while they're out there risking it all.
Thank you once again.
Perfect. Well, amazing video. Yeah, I can see a lot of these claps going on. So it was really exciting and interesting to get the kids' viewpoint as well. And I've had a lot of discussions at home, I'll tell you that. But anyway, so you know, all the panelists, Manas, Shohinee, Shivani, Parvez, Shahana, thank you. Thank you from the bottom of our hearts. Sahana for moderating and coming up with the concept. All the kids who featured in the short video capsule, we got Treya or Arna, Cookie, Loya, Gargi, Prishni, Rihanna, Joey, Anuva, Avni, Atharv, Sangamitra, not a kid, but she was there. And Ayan for the terrific video editing, and Ashaz for creating our flyer. So thank you, folks. I mean, I still remember asking Ayan to make some changes, and he sent this last night, past midnight actually, to make some, after making some editing. So, you know, this was the commitment from everybody. So again, thank you everybody for taking the time today, the panelists for leading us through some of your respective professional experience and journeys over the past year or so, how things have evolved in your professions, your experiences along with many other community members and beyond, who, you know, it's very rich, insightful, and above all, I would say humbling experience, right? To hear these stories. And these stories and experiences, they not only tell us that there is a silver lining, we've talked about it, it tells us that nothing is impossible. You know, another pandemic could be around the corner, it can happen again. But more importantly, I think it shows us how we as a human race are perseverant, we are resilient, we can continue to innovate, be it in whatever sector it is. We have learned to be thankful for the small pleasures and the micro moments of life. And I think we have learned to come together and care beyond our families and friends. We have started caring for our community. So, Aham Khongho Canada salutes all the frontline workers and offers our gratitude and appreciation. Stay safe, get vaccinated if you can, and hope to see you all in person sometime soon. And do not forget to visit our website, www.ahomhongha.ca. And this will be available on our social channels. The recording will be available on our YouTube channel as well. So thank you, everybody. Have a wonderful afternoon. Enjoy the summer. We'll see you all in a few months.
Thank you, Polas.
Thank you, everyone.
Yeah. Thank you.
Yeah, absolutely.
I'll keep this on. If someone wants to chat, I'll stop the recording, but you can chat.